Current issues with Indigenous communities today.
The current issues we're dealing with is a lack of housings on the reserves due to the poor grants. Even if there is housing on the reserves, the housing conditions are horrible from inadequate ventilation, broken windows, leaky roofs, and water damaged walls. Would you like your grandparents or parents to live in these conditions? In 2016, throughout 2021, the indigenous population grew by 9.4%, but the housing stock did not increase, resulting in a lot of homeless indigenous people living on the streets or sharing a small home with 2 to 3 different families. Living in overcrowded conditions will impact mental health like stress, depression, and even physical health problems. By working together with the local landscapers, reducing the cost of constructions, and even more awareness of what is affecting around us with indigenous people and the culture, we can reduce and help strengthen the community and will help the next generations of First Nations.
Higher suicide rates within Indigenous communities. Indigenous people are known to have some of the highest suicide rates in the entire world, and it's one of the leading causes of death in Indigenous youth today. There are many reasons for this, which include the consequences of colonialism, discrimination, community disruption, and their loss of language and their culture. Indigenous people also have a much higher likelihood of experiencing severe trauma than someone who is not Indigenous. Due to colonialism, trauma has been passed down generations, which is also known as generational trauma, which is a big issue within the Indigenous community today. Colonialism has also made it not possible for many parents and elders to pass down Indigenous teachings and knowledge to children due to their loss of culture, traditional values, and family stability. Luckily, there are now many mental wellness teams and services that can be used, like National Inuit Suicide Prevention Strategy and Indian Residential Schools Resolution Health Support Program. Now, unfortunately, this isn't enough, and more has to be done. The promotion of Indigenous life can include strengthening their bond with their heritage and culture, trying to be more connected to their community, or even just speaking to an elder. Indigenous lives are important, and more has to be done to protect them.
So now I'm going to talk about an issue that's really important, the health of indigenous people in Canada. First, let's take a look back at history. Colonization had a huge impact on indigenous communities. They were forced off their lands, and the residential school system caused a lot of trauma. Now, health isn't just about physical well-being. Social factors like poverty, education, and housing are big parts of the picture. Many indigenous communities struggle with these issues, leading to higher rates of chronic disease, plus access to healthcare can be really limited, especially in remote areas. There is also a cultural aspect. Mainstream healthcare often doesn't align with indigenous healing practice, which can make people less likely to seek help. Mental health is another huge concern. The history of trauma and ongoing discrimination contribute to higher rates of mental health issues like depression and anxiety. But there is hope. Many indigenous communities are taking charge of their healthcare, combining traditional practice with modern medicine. The Truth and Reconciliation Commission has also laid out steps to improve health outcomes. In conclusion, we need to acknowledge these historical and social factors to make real progress. By working together and respecting cultural difference, we can improve the health of indigenous people in Canada.
Unfortunately, these issues still continue to plague Indigenous communities. While there's been an increase in awareness and programs for supporting Indigenous people, these are still largely ongoing and need further action and support.